Thanks to the conference organizer for giving me this opportunity to present some Doxy PrEP data in Australia. So we'll probably learn a lot from Thomas' presentation, but just recap, doxycycline prophylaxis, Doxy PrEP, is an emerging biomedical strategy to prevent STI. It involves taking 200 milligrams of doxycycline within 72 hours after condom sex. Recent systematic review actually summarizing clinical trials and cohort studies showing Doxy PrEP can reduce the risk of antibacterial STI by 46%. But when we actually look at different specific pathogens, we can also see that it can reduce chlamydia by 65%, syphilis by 77%, but there's no significant effect on gonorrhea. There have been also some concern about potential increase of antimicrobial resistance with the increased use of doxycycline. So in Australia, we published this Australian consent statement on Doxy PrEP in September 2023. We recommend Doxy PrEP should be considered primarily for prevention of syphilis in gay bisexual men who are at risk of this STI. But we also acknowledge that some individuals may also have benefits for chlamydia and less reduction in gonorrhea. So this study aimed to examine the awareness, usage, and also concern about Doxy PrEP in Australia. So we conduct this cross-sectional anonymous survey in Australia from July to November 2024. It was co-designed with the community members and also LGBTQIA+ organization. We collect data on Doxy PrEP awareness, uptake, access, and concern. Participants who are 18 plus living in Australia and also self-identify as men, transgender, or non-binary persons who have sex with men were eligible to participate in this survey. So we have both clinical and non-clinical recruitment. The map actually shows our clinical sites, which include 9 public HIV STI clinics, 6 GP clinics, and 4 community clinics. We also recruit participants from social media, dating apps, and also through our partner community organization. So we have about 2,000 valid and complete response in our survey with median age of 39 years. Most of them were cis men and 65% complete the university degree. So in our cohort, we can see that 2/3 of people actually using PrEP and 9% are people living with HIV. And 68% were recruited from non-clinical setting versus 32% from clinical setting. So overall, we are seeing like 52% of participants have heard of Doxy PrEP, and we can also see that the high awareness was seen among PrEP users with 60% and also 51% among people living with HIV. And this probably highlights that these people are more likely to aware of HIV and STI prevention and also more engaged to sexual health clinic. And most of the people actually have heard of Doxy PrEP from their friends, followed by health professionals and social medias. So in terms of usage, so we only ask this question among those people who have heard of Doxy PrEP. So among those 1,000 people who have heard of Doxy PrEP, we are seeing 30% of people reporting ever use and 28% report using Doxy PrEP in the last 12 months. But we consider the entire population, we're actually seeing 15% in our population using Doxy PrEP. In terms of how they use it, 63% took Doxy PrEP according to the guideline with 200 milligrams within 72 hours. 14% reported they took 100 milligrams daily, and 22% actually used a non-recommended regimen such as using 100 milligrams, or some people actually report a 2-1-1 regimen like HIV PrEP. The reason of taking Doxy PrEP mostly actually report to reduce the risk of getting an STI and also to reduce the need of getting STI treatment, particularly an injection for gonorrhea and syphilis treatment. Also want to reduce the risk of passing an STI to their regular or casual partners. We also look at the factors associated with Doxy PrEP use, people living with HIV and also PrEP user, people who are in a sexual relationship and also who had sex party in the last 12 months were also significantly associated with using Doxy PrEP in the last 12 months. In terms of the source of doxyprep, so in Australia, we need to get a prescription, like to get a doxycycline for use. So 42% said they directly get the doxyprep from the doctor's GP in Australia, 38% from a local pharmacy with a prescription. But also we can see that there's some informal reception from including 16% from a friends or a sex party and 15% from leftover from another treatment. About 5 to 10% also getting doxyprep online or in person from another country without prescription. So what do our participants hope to prevent by using doxyprep? 90% say chlamydia, 81% gonorrhea, 70% for syphilis. But interestingly, that some people actually also hope to prevent some other infection that with no current evidence, from 3% mpox to 11% Mycoplasma gelatium. So this probably highlights some misconception, and some people may probably get confused with treatment as well. So when we ask people who did not take doxyprep, what are their concerns? 41% said there's still not enough information for them to decide taking doxyprep, and about a third of people actually worry about antibiotic resistance developed in their community and also by themselves. So to conclude, so only half of the participants surveyed were aware of doxyprep in Australia. 1 in 5 use a regimen that is not currently recommended. Highlight we probably need more education resources to educate our community. 1 in 7 people who source doxyprep without prescription, that actually also highlight that we probably need more clinical guidance to ensure they use it safely. And we also probably need to address some misconception that some people actually use doxyprep like to prevent some infection with no evidence support of the effectiveness. From Thomas' presentation, we also know that there have been very limited data in Asia. So we are very excited to have this collaboration and set up this Doxy Asia study to collect more data on doxyprep use, awareness, and other data. Currently, we have 9 countries participating, so we're very keen to also welcome other countries that are not listed here. We're planning to start this study by the end of this year, so if you're interested and your country is not listed, I'm very happy to talk to you during the conference. And lastly, I would like to thank my team and also my collaborators. Thank you.
Yeah.